That's gorgeous.
Sherry Dellen has a family history of Alzheimer's disease. Her mother had it, and her sister is now living with it. Diagnosed at age 70, Sherry now has to face her own illness.
My kids were nagging me that I'm getting very forgetful and I should really go and get it checked out.
Alzheimer's disease is a degenerative brain disorder. It includes the ability to do things one used to be able to do. So therefore, Alzheimer's disease, in addition to affecting memory, also in the course of this illness, people forget to do things they normally would know how to do.
I know I'm forgetful, but I felt it's normal forgetfulness.
In order to make a diagnosis of Alzheimer's disease, patients' symptoms need to be tracked.
Look at it for about a minute and a half, and then I'm going to have you flip it over and see how many you can recall.
Alzheimer's disease is best diagnosed by a physician taking careful history.
How about here?
The fact that the individual is no longer functioning the same way that he or she was before is often really the best indicator that there's a significant problem.
Well, I filled in today in the morning.
Well, the behaviors that we noticed in my mom, which made us want her to get checked out, were pretty much a lapse in memory. We know just little things, nothing major. Maybe forgetting where she had placed something, maybe forgetting an event that we had talked about, sometimes a repetition in telling a story.
Along with a thorough patient history, doctors will always perform cognitive tests, a basic neurological exam, and some lab work to rule out other possible causes for the cognitive changes and memory loss. But once a diagnosis is confirmed, there are treatments to help. By getting her forgetfulness checked out, Sherry was able to start on medication right away.
I think that I catch a name faster, and if I'm talking about a place and I can't think of the place for the moment, the name of the place, that comes to me quite often. So that's why I think that the pill is helping.
Treatment also includes non-pharmaceutical therapies.
The other thing, there's been a lot of focus on something that we call cognitive rehabilitation. And the question is, can you actually retrain someone? Can you provide them with mental exercises to improve the course of it?
In order to combat the symptoms of Alzheimer's, Sherry is part of a study involving cognitive rehabilitation.
They do actually, it's exercises in cognitive functioning, different ways of doing things. For instance, keeping a journal or writing things down in a book so that they don't forget. Making sure that they take their pills on time and writing down in the book when they take their pills so that it tries to help, just kind of like a reminder for them.
It's just another way of keeping a person actively involved in life, and that can be very important.
Although there are many mysteries still to solve with Alzheimer's disease, beginning treatment early may allow patients to maintain their independence for a longer period of time. Staying active physically, socially, and mentally, plus taking the appropriate medications, may offer the promise of a better quality of life for both patients and caregivers.